Watkunuradu, and welcome to the COVID-19 Task Force Daily Briefing. Our time is about 20 minutes after 4 o'clock on a Saturday afternoon. Wishing you all hopefully a very nice day. Hope you got some fresh air. In the meantime, there are some big developments today, and we'll start things off with the Executive Director of the Kateri Memorial Hospital Centre, who's also the official spokesperson for the KMHC. Once again, here is Lisa Westaway.
Good afternoon, thank you. So today I'm starting first today. We changed things up a little bit, and Lloyd's going to speak after me. I'm going to give a little bit of an explanation today of community transmission, and this is so that you have a little bit of an understanding of why we're implementing some new changes today. So what I want to explain, I'm going to read to you a definition actually that for community transmission, and it has nothing to do with Kahnawake specifically. This has to do with, it's a very general term that is used in the medical profession with respect to viruses. So community transmission is when the source of infection for the spread of an illness is unknown, or a link in terms of contacts between patients and other people is missing. So that's an official definition. What that means is that when you get to community transmission, when you're saying that a virus is transmitted through the community, it means that you are no longer able to identify the first person who had this virus, and therefore you're not able to do a tracing of all of the background of where this virus has come from. So what we're starting to see is an evolution in the actual different cities surrounding us, where there are pockets of community transmission. So we're seeing it in different areas of Quebec, but what we do know from our contacts is very clearly that in the Montérégie area, there is no community transmission right now. So again, what that means is that we're able, public health, when someone is identified as a positive case, public health is able to identify where the person, all of the people who were in contact with the original person who was diagnosed. And so that is an interesting fact when we look at other areas of the cities surrounding us, notably just on the other side of the Mercier Bridge. There are some areas that are really identifying that they're at a point where they can no longer say that it's because of someone who traveled, or they can not pinpoint who the positive person was in contact with. It's considered a more generally spread virus. In Kahnawake in particular, as we've mentioned, we know that there are many people who have been tested. We know that we have had some negative tests. We can't say 100% what the situation is in Kahnawake, but we know that we do not have any identified positive members of Kahnawake at this point. And we also can say with quite a lot of accuracy based on public health and MUHC infectious disease that the physician did not, that there is no possibility that the physician in Kahnawake who tested positive infected any cases in Kahnawake. So with all of that in mind, we can very confidently say that we don't believe that there is any community transmission in Kahnawake at this point. So that being said, I'm going to just summarize. We have confirmed information that there is not community transmission in the Montérégie area. We are quite certain that there is not community transmission in Kahnawake, but we know that there are pockets of cities over in Montreal and surrounding areas of Quebec that have community transmission. Therefore, considering that and considering our close link with the Montérégie area, we feel, and considering the increase in the virus over time and how quickly the virus spreads. We feel that we have a very small, short window to implement some drastic measures to be able to further protect the community and ensure that we are keeping the spread of the virus as low as possible. So the message is that we're doing a really good job. We're working hard. We need to continue. We need to continue to implement measures. And we feel that we have this short window before we move into a state of community transmission in areas close to us to implement some further stronger measures for, again, further protection. So with respect to the hospital, I will talk about one of those measures, and then Lloyd will discuss some others. So for the hospital, the first thing that I wanted to mention is about the pharmacies. So what we will be doing effective today is closing the pharmacy to visitors. So what that means is you should be contacting the pharmacy, you would be ordering your medication, your prescriptions, your renewals by phone, or working that out with your pharmacist to look at the best way possible to ensure that you continue to get your medication. We'll also have a drop-off section between the two doors. So at the entrance, specific entrance for the pharmacy, so that nobody actually comes into the pharmacy, and in that way we're protecting the pharmacists and the employees of the pharmacy, and we're also ensuring that there aren't any more people coming into the building, into KMHC, that are walking through for the pharmacy. The Old Malone Pharmacy will be implementing similar measures by the end of today or by tomorrow morning. So I really urge you to contact your pharmacist to look at the best way to ensure that you continue to get your medication, your renewals. Another thing that I wanted to mention was access to the testing center. So we've made some continuous changes over time, and just remember, measures that we implement, information that we get changes quite rapidly. So what's important today is that you can call 811. So over the last little while, we've been telling you to call 1-877-644-4545. That number is still available to you for all of your questions regarding COVID-19, but they will not assess you in order to decide whether you should be oriented to a testing center or not. You could call 811, and as I mentioned yesterday, access to the nurses at 811 has been greatly facilitated over the last couple of days. Most people getting through within 5 to 10 minutes, and most people getting appointments for testing within 24 to 48 hours. So I urge you, if you have the symptoms, if you meet the criteria that we've described, that you call 811 and be assessed for the possibility of testing. So those are the main changes for KMHC. I'll let Lloyd explain the rest. Thank you.
All right, thank you, Lisa. And for more details on the pharmacies, you can actually check out the press release that was issued earlier today, and that is available at covid-19.kmhc.ca. All the details are there, but again, it's really simple enough. If you have to contact them, you can contact them by phone and work it out. In the meantime, there are some new directives that are important information for the community, and the Commissioner of Public Safety, Lloyd Phillips, will take care of that. Lloyd?
Thank you very much, Joe. Thank you, Lisa, for that explanation to the community on what community spread means. And it's something that, in my opinion, is somewhat of a game changer in terms of how the progression of this pandemic is evolving around the area of Kahnawake. So we have to look at what's happening and adjust what we're doing moving forward. I wish I was able to come up here and say something differently this afternoon, but unfortunately, we have to implement stronger measures. So I know many of these things have already taken place to a certain extent. People have shown goodwill to take precautions and do the right thing. but we have to formalize some of the decisions and give clear direction to the community, such as stopping any type of social gatherings of any sort, including places of worship, the churches, with the longhouses. I know they already took measures, but it's something we certainly want them to continue to do. And any other type of reception hall or group where people can gather in the community are to close. The goal of this is to limit the amount of people gathering in one place and minimize the possibility of somebody who maybe have the virus to transmit it to other people. It's not about anybody's religious beliefs or anybody's way of life. This is about minimizing the risk to our entire population, all Kahnawake Ono. So that's the first decision that was made today. Secondly, in response to, again, the many requests, to be honest with you, from community members and many questions asked by community members, the issue regarding the cigarette stores and factories. I know some of the owners of the factories and stores have taken precautionary measures, and I certainly appreciate that taking place. But again, we have to formalize something, and then at this point, all cigarette stores and factories are to be closed. This is to minimize the amount of people not from Kahnawake entering our community who we have no clue where they came from, and we want to minimize as much as possible people coming to the community who we are unaware of their background. So that's something that is extremely important to ensure the protection of our community. It is also on a side note to that, I was speaking to Grand Chief Joseph Norton this afternoon, and we're going to be fast tracking any type of support mechanisms for individuals who are impacted. So we should have more news on that in the coming days. And lastly, there's a something for all Kahnawake Ono. It's all Kahnawake Ono are asked to remain as much as possible in the community. Now, essential travel to get groceries, medications, or such in surrounding communities is fine, but we are urging people, and it's strongly discouraged for you to go outside the community for non-essential purposes. Like I said, food, medicine, do what you got to get, and come back to the community. So again, we want to limit the potential of your exposure to somebody from outside the community and bringing it back here. We want to slow the progression of this, and these are some strong measures in which we feel are appropriate to slow the progression. Like Lisa mentioned, there's this term called community spread. It's in the Montreal area, it's in the Quebec City area, it's in the Sherbrooke area. Unfortunately, they call it the Montérégie, which is basically, as we know, is the South Shore. There's none here. But if you look globally, you look what's happening in other areas, we have to take measures now to be ahead of the game to protect our community, because things are evolving rapidly at a pace that is even surprising some of the professionals, the people who are studying on this virus. So these are strong measures that have to be put into place, again, to protect the health and well-being of our community. So with that, I think I'll leave it there for now. More information, as usual, will be forthcoming. These things, people will be notified directly as well who are impacted by these decisions. But I'm hoping at this point in time, people who are out there, could help spread the word. Like I said yesterday, we're all in this together. It's not about one individual or two individuals. No, we're Kahnawake. We're here to protect Kahnawake. And as I said, Kahnawake, we're special, and let's keep it that way. Now we'll go.
Well, thank you very much, Lloyd. Very well put. Thanks to Lisa Westaway as well from the Kateri Memorial Hospital Center for her insight and information. Once again, if you need information, covid-19.kmhc.ca. And of course, there are many other places you can get it. We've gone through them at every day. You can watch it on Paul's Cable, be on later on. And check the websites. We have as much information going out as we can, but we are doing this briefing each and every day, roughly around this time. We've said 4 o'clock. I don't think we've ever hit 4 o'clock yet, but today was pretty early. We're going to try and keep it around 4:30, 4:15, as much as possible, so you can watch it live. But then again, you can go to Facebook at, what is our address again? Kahnawake 911 on Facebook Live, and you shall be able to see it and at your own leisure, or you want to see it live, that's up to you. So once again, folks, we know we can't stop the virus from coming, but by working together, we can help prevent its spread. Take care, everyone.